Hi everyone, we're back, and today the topic for discussion, this will be session 60, and the topic for discussion will be care planning and patient teaching. Patient admission / anxiety, care planning of the post-operative patient, DVT, skin breakdown, organ transplant patient, diabetic teaching, and Maslow's hierarchy of needs in the clinical setting. Now, we're going to start off with when a patient's admitted to the hospital. From the nurse's standpoint, I know we admit patients to the hospital. It's really not, we don't really get that deeply into that side, but we don't really appreciate the sort of anxiety that patients go through when they have to be admitted to the hospital. Consider if you got a diagnosis that you really didn't want to hear that was going to affect your family members, your lifestyle, and here you are being admitted to the hospital. Not a doubt you would be overly anxious. So one of the concerns for the care plan inevitably would be anxiety. This would be related to hospital admission, and of course I would caution you that the nurse should always try, if she can, to explain what she's doing to that patient. Sometimes it's not always, sometimes we do things in a rush. Sometimes some people don't even have a real explanation, but if you can, if you have time, and if you can make it easier on that patient and family, it would not be a bad idea to try to address what you can as you go along doing things to make it easier on them. I have taken over patients where they said nobody's ever discussed anything with them. They did not even know what an ICP monitor was. They just saw lines and tubes in the ICU and how frightening it was. So let's talk about the post-operative patient. The post-operative patient is always at risk for pneumonia, wound infection, and skin breakdown. So these are just a few of the concerns of the post-operative patient. You have things like bleeding. You can even have things like, separation of your wound, your incision. When you have wound dehiscence, there are just a number of things that can go wrong and can go right also. So patient and family teaching will help to prevent these problems if you can explain to the patient why you want them to deep breathe to prevent pneumonia. When you check your dressings, why you're doing it, take every measure to prevent infections like wearing your gloves and making sure you do everything correctly. And of course, skin breakdown can be prevented by turn, cough, and deep breathe. Very, very helpful, preventing skin breakdown and pneumonia. Well, let's just discuss deep vein thrombosis. Deep vein thrombosis can happen to any patient who is confined to bed and has limited mobility. You can learn more about this topic at Care Planning and Patient Education, dearnurses.com. Also, dearnurses.net has very helpful information on DVT, deep vein thrombosis. The big thing is some people wear sequentials, some people wear those TED hoses, and of course, I've seen doctor's orders that reflect teaching patients to march in bed. That movement helps to keep the circulation going, and just make sure you follow the doctor's instructions. That prevents patients from having that stagnation in their circulation. Some people don't like wearing those hoses. They complain about them when they, squeeze and let go and squeeze and let go, but it has to be done for what it's worth. So it's important for the nurse to do what is called patient teaching and express to the patient why it's so important, even though they don't like it. Why it's so important for the recovery phase that you have to wear these hoses, just like why you have to explain to them how to prevent a pneumonia. And above all, let's not forget, these are the sort of things you will have on the care plan, because the care plan is where we put all this, we document what has to be done for that patient. Another group of patients that's of great concern is patients who have, let's take these two patients, they both have something in common. They both had organ transplant. One had a heart transplant, the other had a liver transplant, but they both have something in common. They will need teaching because these are patients who are going to take medication for the rest of their lives. It's not just going to be a start and stop. There are different signs they have to look for, like signs of rejection if they start having fevers. There are things like bleeding that may occur. There's a lot that has to be learned. And then above all, to take their medications and what to look for. These anti-rejection medications such as Prograf, which they have to take on a daily basis. And the family also has to be taught to help these patients also to be able to comply with what they're meant to be doing. And all this can be reflected in the plan of care. Now, as far as nursing considerations after a patient has had an organ transplant, bear in mind that the immune system does sometimes reject an organ, and this, you might get bleeding. I've seen a patient after he had a wonderful surgery done, everything went really well. But one morning we went to give him breakfast and everything just burst open. There was blood everywhere. So it can happen, doesn't always happen. It's the exception and not the rule, because most times it doesn't, but it can happen. So all of this should be, bleeding can be reflected in the plan of care. Organ rejection also, these are considerations also. And that, of course, like I said, you know what steps you follow. Always follow your doctor's orders, institutions, policies, and procedures. And of course, there are usually family meetings after a patient had a transplant. The social worker also is involved, the coordinator, the transplant coordinator. They do their own follow-ups as necessary. Here we have a patient who's a 35-year-old male, and he had an open heart surgery 2 weeks ago. Wound healing has been very difficult because his blood sugars have been hard to control. Questions have been raised about family members bringing him snacks. It goes without saying that this patient will need teaching, and so will the family, because they may not fully understand the severity of what could happen to a patient who does not eat within the boundaries of what he was told to, like the dietitian's food. And when meals are brought in, it messes up his blood sugar, and the blood sugar, when it gets very high, affects healing. So these are considerations again. And you can get information, more information on this topic, care planning and patient education at dearnurses.com. There is a lot to be learned about diabetic teaching. And as I close the book, I just wanted you to know that there is, I would reference a video to you, and this is called Sessions 39, and it's called Addressing Maslow's Hierarchy of Needs and the Care Plan. This will be very helpful for the topics that we just discussed. Have a great day.